Ever had a STYE and felt like it was holding you hostage, keeping you from facing the world? Let me share with you an experience at the pharmacy consult window
that vividly illustrates the profound impact very small ailment can have.
Hi, I'm Dr. Will, licensed pharmacist with a Doctor of Pharmacy degree, dedicated to serving the community through compassionate care and expertise. Within the busy walls of the pharmacy consult window, I experienced a myriad of questions and concerns. Today, I invite you as I share with you one of these experiences. One afternoon, a young lady comes up to the console window. She had on dark glasses and a hoodie. She asked the pharmacy technician if she could speak with the pharmacist. From where I was at, I sensed her apprehension and said, "I'll be right with you." I worked my way over, introduced myself while extending an offer of assistance. With a sense of shame, she raised her dark glasses and showed me the swollen and inflamed STYE that was tormenting her. As the conversation continued, her words conveyed a mixture of sorrow and desperation. She shared that she was going to be a bridesmaid in her best friend's wedding, a role that she cherished for many years. She felt that the STYE was threatening to overshadow this joyous occasion. With tears in her eyes, she confided in me, recounting the months of meticulous planning and anticipation that led to this moment. And now it could all be ruined because of this noticeable STYE. And to make matters worse, the wedding was to take place in 2 weeks. In that moment, I was reminded of the profound impact that the smallest of ailments can have on one's emotional well-being. Here stood a woman dealing with a physical affliction that transcended the boundaries of mere discomfort, threatening to undermine her sense of self-worth and belonging. As a pharmacist, my duties extend beyond the duties of merely dispensing. It encompasses providing solace and support in times of need. With empathy guiding my actions, I embarked on a mission to alleviate her distress, offering a range of treatment options that I will now be sharing with you. Let's first start by defining what a STYE is. It is medically known as a hordeolum, typically characterized by a lump or swelling that looks a little bit like a pimple on the edge of the eyelid or inside of the eyelid. It occurs when one of the glands along the eyelid becomes blocked, leading to the accumulation of oil and perhaps bacteria. Our eyelids contain 3 glands: gland of Zeiss, gland of Moll, and meibomian gland. The gland of Zeiss lubricates our eyelashes. The gland of Moll is a sweat gland, and the meibomian gland prevents the evaporation of our tear film. When one of these glands becomes blocked, that's when we experience a STYE. Some of the risk factors for acquiring a STYE include poor eyelid hygiene, bacterial infection, conjunctivitis or pink eye, chronic blepharitis, contact lenses, eye makeup, rubbing or touching your eyes, an underlying skin condition, hormonal changes, and stress. Duration can vary based on several factors, including its size, its severity, and the individual's healing capacity. Initial onset may be 1 to 2 days. Swelling or progression can take place between day 3 and 5. Maturation and pus formation can take place in days 7 through 14. How can we help prevent a STYE? Well, one of them is using good eyelid hygiene, washing your face, not rubbing your eyes when your eyes are dirty and you haven't washed your hands, removing makeup before you go to sleep, avoid sharing personal items like your towel, your bed pillow, etc. Practicing good contact lenses hygiene as well. Replace your makeup when it expires. Know when your makeup expires. Replace it when it expires. Do not keep your makeup in a moist area. Also, managing stress. How can we help cure the STYE? The STYE should go away on its own after several days, perhaps a couple of weeks. However, there are several over-the-counter medications that can help alleviate the symptoms and promote faster healing. One of these treatment options, and the most classic, is warm compresses. Applying a warm compress several times a day to the affected eyelid can help soothe discomfort, promote drainage, and reduce swelling associated with the STYE. The way it works is you soak a clean towel in warm water and place it over the closed eyelid for 5 to 10 minutes. Make sure it stays warm. Not burning, but nice and warm. Keep in mind that the STYE is a blocked gland, blocked by usually oil that is produced by that gland. By applying that warm compress, that warmness is sort of melting the oil and promoting that drainage. Therefore, it's important to also rub the eyelid in this certain motion in order to help drain it. Also, eyelid scrubs or eyelid cleansing wipes containing ingredients such as tea tree oil or hypochlorous acid can help cleanse the eyelids and remove debris and bacteria, along with the oils that may contribute to the STYE formation. And always follow the manufacturer's suggestions for proper use, okay? Artificial tears also help, also known as eye drops. It can help alleviate the dryness and irritation. These drops can be used as needed to relieve discomfort and keep the eye moist. Recommended pain relievers, just in case there is pain associated with the STYE, are ibuprofen and Tylenol, depending on your case and age. But ibuprofen can help definitely with the inflammation and the pain. Also, antihistamines, if itching and allergic reactions accompany the STYE. Oral antihistamines such as loratadine, also known as Claritin, or cetirizine, also known as Zyrtec, may help alleviate some of the symptoms. Now, if after a few days of implementing these action plans, you see that the STYE is not getting better, then you need to contact your physician or ophthalmologist, and they need to implement other steps that may include oral antibiotics such as doxycycline. It might include antibiotic eye drops. It may include a steroid injection or even surgery. Your ophthalmologist or physician will determine that at that time. If you follow these suggestions, everything should be kosher. Everything should be good. The girl at the beginning of my story, that's what she did, and it certainly helped her. She followed the steps I outlined for her with the over-the-counter medications and methods, and with each passing day, the swelling started to subside, and she got rid of the STYE just in time for the wedding. After the wedding, she came by the pharmacy, now with dark glasses and a hoodie, looking all grim. Now she came with a radiant smile, happy and joyous. I sincerely hope that these tips can help you as well. And if you know anyone that is going through this situation, make sure you share this with them. Also, make sure you click like, follow, and comment on this topic, please. And share this with your friends and family. Thank you.